Thanks for the introduction, Barry. Good afternoon, everybody. My name is Ogie Sheehy, and I'm the founder and the European CEO of a company called ViClarity. I also operate as the global CIO. I'm delighted to be here today to talk to you all for the 2021 Future Health Summit. Remote, virtual, in these new challenging times, but it's great to be here all the same. I'm going to talk a little bit today about how to successfully partner with technology in a healthcare setting. So I suppose just before I do that, I want to talk a little bit about who ViClarity are and what it is we actually do. So ViClarity is a software company, and we provide tools and technology for audit, risk, and compliance in the healthcare sector. So we try to help people move away from manual-based processes to streamline the collecting of information, the administration processes, and really help people, I guess, to be more efficient in collecting that quality management information across a healthcare setting. We work with a number of organizations across Ireland, the UK, and most recently in the US. And I suppose our overall goal and mission really is to provide technology to help improve the quality of care of patients within a healthcare setting. So, as I mentioned, we work with a lot of organizations across the globe, really, and our goal and vision is to really simplify things and to improve the quality of care. I'm going to talk today about partnerships specifically, and share some experiences over the last 12 years that I've had and as our team have in terms of implementing that technology. But before I do, just to quote Courtney Kemp, when it talks about partnership, it's defined as great partnerships thrive because the people need each other. So I think it's a really powerful statement when it comes to the term partnership. So I suppose to talk a little bit about what does a good partnership actually look like. I want to just reflect for a little bit before I move into that, just on the old traditional buyer-seller model. And you'll all be familiar with, the old cliche of the cheesy sales guy coming to the door selling electrical appliances with a shiny suit and a briefcase, who's the traditional model some people think about when they hear about someone being a salesperson or selling a product or a system. And on the buyer side, in that same kind of scenario, historically would be, a parent or a mom inside the house hiding behind the curtains, kind of wondering, is he gone from my door yet? So that was the old kind of stigma, I guess, associated with, a buyer-seller type relationship. Whereas nowadays, I think things have moved on, and partnerships really are all about, having a need identified on the buyer side. So somebody that is looking to buy something or implement something where they've identified a problem statement and there's a need there to be solved. On the selling side, it's where there's a solution made available. So where there's an offering or a solution out there that can help the buyer solve that problem that they have identified. And I guess then it's a combination of the collaboration of both parties for results. So collaboration really is a key word when it comes to partnership and when it comes to success in terms of working with technology and with the health systems. And I guess that gives a nice recipe then for success as you move forward. I want to talk now about, when does the partnership start? What's the right time for an ultimate partnership to kick off? And the answer is as soon as possible, as early in the process as possible, because you want to involve all the relevant stakeholders. So just as an example, if you were implementing a quality management software tool into a healthcare setting, you need to get the right people involved. And that means involving stakeholders from the top down and likewise from the bottom up. So just to explain a little bit about what that means. The top down means having all of your executives on board and aligned with the philosophy of what it is, what problem initially you're trying to solve, and then what potential solution you're trying to implement to solve that problem. From a bottoms up perspective, it's making sure that the people that can be impacted on a day-to-day basis, frontline workers, nurses in wards, carers in nursing homes, that if they're going to be impacted in the implementation of the solution, they also need to be involved at a very early stage in that process. And then I guess you get full buy-in to the whole approach in terms of the successful implementation of the tool set. Now, a typical kind of a partnership always should center around good project management. So when you embark on trying to make change or influence change in a health setting, you need to have a framework that you work within. And to the right side here, you'll see, here's just an example of some of the items in the past that we've looked at and some of the methodologies that we've worked on. So your typical 5-stage implementation, so you've initiation, planning, execution, monitoring and control, and closing. And it's project management stuff, but it's so important to have that framework or methodology when you go down the road of trying to implement change in the health service. Moving on from that, a critical piece in the process is that kickoff call between the buyer and the seller in this example, to agree common goals. So again, you partner with the supplier, you understand what the goals are. So there's clear goals and set out from the very start of the process. That means understanding what are the deliverables. So within the system that I'm trying to influence change in, what's the outcome? What are the desired outcomes that I expect to deliver? And what are the milestones that I'm going to achieve along the way? So specifically for longer term projects, I need to be able to know that milestones are identified, timeframes are set around them, and that they're delivered in a way. And I suppose the identification of your stakeholders is another critical part of the process. And I spoke about that earlier. So your stakeholders will fall into 3 main categories. Your project team, and they're the people that will work with you to implement the actual process itself. The end users who will form part of that team, and they're the people who will be trained on the system, who will actually be directly affected by the outcome of the system, the implementation. And of course, your executive steering committee. The executive steering committee play a critical role in the whole process. And that's almost governance around the process of the introduction of the new technology. And that's just ears and eyes to make sure that all of the parties, I guess, are heading in the right direction. Everyone is out to achieve the same goals and that everything is on track. And typically a steering committee meeting for a larger project can take place, usually maybe once a month. And for those that are not, they'll take place then, maybe on a weekly or a bi-weekly basis. So I suppose considering partnerships and innovation, and if we think about the example of introducing a technology solution, first things first, it must bring value. And value can come in a number of different forms. One of those can be cost savings, which is a way where you save money. It could be in terms of driving efficiencies in your environment or your location. It can be visibility of data. So if you don't currently have visibility to the data you need to make decisions, that can be value add. Accountability. So making people more accountable for what they do and having a system drive that level of accountability. It could be access to data. So we are scrambling, trying to find information on spreadsheets or on paper. So having access to a system. And I guess important is consistency in how data is collected. So making sure if you're measuring something in a process, that everybody is measuring it in a consistent way. And of course, once the information is collected, it's the collating of all that information then into a view that makes it visible and usable by people to make decisions. So the benefactors, so who benefits from the information? Well, clearly a board who might need information to see how the overall organization is performing. An executive team, execs who are trying to make decisions about the performance of the environment that they work in. Again, heads of quality, taking actions, looking to move into certain directions, so making decisions from a quality perspective. Directors of nursing or assistant directors of nursing, again, nursing metrics. Where is the information? How are we performing? Where are the gaps and so on. Nurses on wards. So again, knowing the performance and how their own wards are performing. Of course, owners and managers. If you own a nursing home or a group of nursing homes, knowing exactly how you're performing. And staff nurses having real-time access to information, which makes them and allows them to adjust their decision-making process kind of on the spot. And of course, regulators, which is really important, whether it's HICWA regulators, whether it's the Joint Commission, JCI, or others. It's just, again, having access to that relevant information is really, really important. So that's kind of looking at the value. If I look at a traditional data system in a health environment or a health setting, you look at the overall quality management of that environment, which is broken out into 2 main areas. You've got the governance framework, which is looking at all of the governance information on the performance of the facility. And then you're looking at the regulatory framework, which is the regulations driving those particular standards. And typical, and this is not an exhaustive list, but you will be looking at the risk profile of information within the hospital environment. You'll be looking at the audit information or the quality information. How are we performing to certain areas of quality standards? And then, of course, incident and complaint information. And there's lots of other information, more operational data, looking at patient performance and so on. But this really is looking at a quality management framework and a governance approach. And of course, these all link and stem back to your policy. And your policy internally within your organization will be driven, as I mentioned, from both the governance side and also from the regulatory side, leading you to a place where you have lots of information. And it's really about the ability to collect the information in an effective way, an efficient way, and be able to get the outputs. And I'm just showing some examples, some control charts, some run charts of the different types of dashboards and information that can be presented. Of course, the overall goal is to identify trends, identify gaps in that information. So you can see, are we trending for the better or for the worse? And take the relevant actions and remediations required to connect all the dots together. And really, it's talking about interoperability. And interoperability is a word that talks about the connectivity of multiple different data sets within a healthcare setting. And it's all of the systems connected, talking to one another. So data flows right through to the benefactors that I spoke about, giving them that ability to make the right decisions in a timely fashion. If I talk again a little bit about, partnering tips. So what makes partnership really, really good? So again, being really clear on the mission and the goal statements from the very beginning of the process, balancing your day-to-day job and being able to devote time to successfully focusing on the implementation. It's important to leave the ego at the door. It's really key to just get on with the project. And also, I suppose, to identify a project team, a team lead, and a team that will focus on that implementation. Vitally important, again, to be open to change. So again, change is required, it's necessary, but also to be able to manage people who might be resistant to change within your organization. And I guess to see the big picture, to look at the overall strategy, look at the overall vision, as I mentioned already, and focus on delivery. Just to quickly touch and maybe finish with some market trends. So I recently read a paper which bowled me over to see that over 60% of all implementations of technology into healthcare fail because of either poor planning, where there's unclear goals, which lead to issues with change management, with scope creep, where the project, the milestones will change, lack of executive sponsorship or leadership, inappropriate skills where you have the wrong people working in the projects, and more importantly, where you don't have a dedicated team of people who are working on the project. So I suppose some key takeaways to finish with for me around the process is be very clear about what it is you want to set out and achieve. Have clear goals agreed by both parties. Two-way collaboration is critical. Collaboration between the partner who's working on implementing the solution, but also strong collaboration and communication from the buyer, in this example, the health system. Set realistic timelines. So be very clear about when you need to achieve the outcome and the milestones in terms of what will get you there. But really build a great team. And a great team is a combined team between the supplier of the technology and of the health system and the health environment themselves to work together. And I guess then deliver results to realize the value. And that's the core message. This has got to be about how do you best set a team up for success in a partnership mode where you can really realize that value from what I spoke about at the very start of the presentation, where there's a problem statement identified, there's a solution available, and it's really about combining the two parties to the table in a collaborative way to get the ultimate partnership to achieve the goals that are set. So that's it for me. Thank you very much for taking the time to listen to my presentation. I'd be very happy to answer any questions that you may have. And I'll also be on a panel following up later on this afternoon. So thanks again for taking the time.